Welcome back, Titans, to another episode of SPC's EMS lecture series. Today in pharmacology, we are talking about albuterol. So albuterol is a drug that clinicians use all the time, mostly for an obstructive airway disease, typically found using for asthma or COPD, anytime you have bronchoconstriction. So we're going to talk about albuterol, what it is, we'll talk about the class, mechanism of action, indication and contraindication, the dose, duration of action, and any kind of special items. So albuterol is a beta-2 agonist. The generic name is albuterol, but you can find in stores, or your patients that are going to the stores for home use may have a brand name of Ventolin or Proventil. So keep an eye on that when you're doing your sample OPQRST and you're assessing your patients in their homes or in a facility. So albuterol can have beta-1 effects also. So we must monitor cardiac conditions, including heart rate. Dose upon dose upon dose of albuterol can affect the patient's heart rate, usually tachycardia. So just keep an eye on that, keep them monitored, and reassess your patient. Albuterol can come in a couple different ways. We can nebulize it, and you can check out our other video for SPC's lecture series on the nebulizer, the setup, and the use. And it can also come in an MDI. So patients at home, an MDI is a meter dose inhaler, and I'll show a picture real quick. So people with a history of asthma, COPD may be carrying around these MDIs in their pocket. A good question to ask is, if you run on these patients for difficulty breathing, shortness of breath, how many times have you used your albuterol inhaler today? So that's something you want to notate in your narrative, and maybe tell the ED once you arrive, hey, this patient has used their MDI over the last 3 days more than 6 times per day, and then what we've done to assist them as well. So albuterol comes packaged, typically in EMS. We have 2.5 milligrams of albuterol and 3 mLs of water, normal saline. So this is going to be placed into our chamber of our nebulizer. We're going to add 6 to 8 liters of oxygen, and we're going to deliver this patient as they inhale it. It's going to be absorbed through the alveoli and distributed, and hopefully help them with their bronchospasm and bronchoconstriction. So ipratropium bromide also comes packaged the exact same way, and I'll show a picture of them close up. Keep in mind when you're grabbing your medications for your nebulizer, especially albuterol or ipratropium, keep an eye on the very top of the drug tab. One has an A for albuterol and one has an I for ipratropium bromide. But they can easily be missed, so always cross-check, always double-check the medication you're getting. So the class, let's talk about the class real quick. Albuterol is a sympathomimetic, a bronchodilator, and a beta-2 adrenergic agonist, short term. The mechanism of action, so when we're delivering this medication to our patients, nebulized, or they're using an inhaler, it's the beta-2 adrenergic agonist, causes the bronchial smooth muscle relaxation, and inhibits mediator release from the mast cells. So we want to smooth that muscle. We want to open up the bronchioles and allow for inhalation and ventilation, respiration, and allow good gas exchange, allowing them to get the air in and out and provide that gas exchange between O2 and CO2. So indication, we already talked about a little bit, but it's basically the treatment and prevention of bronchospasms for a patient with reversible obstructive airway disease. That's where our COPD and our asthma patients came into play. And I have a little entitled CO2 waveform up here for bronchospasm, and we'll talk about that in another video. We'll have a whole video on that. So anytime we have an indication, we have to have a contraindication. So per Nancy Caroline, obviously anytime somebody has a hypersensitivity or allergy to a medication, but we've done our sample history, we've done our OPQRST, we've done a good patient assessment, so we know what the patient is allergic to, that is a contraindication. Also use caution, or it can be contraindicated in dysrhythmias, especially those that are caused by digitalis. We'll talk about more of that, digitalis and dysrhythmias, in another video. But good questions to ask your patient. What is the dose? So 2.5 to 5 milligrams nebulized is our typical adult dose for our albuterol. Now, if you're assisting a patient with an MDI or they have an MDI or maybe you have one in your system, 1 to 2 inhalations is typical through an MDI for delivering that medication to your patient. And that's usually around 90 to 180 micrograms for that. Let's talk about the duration of action. So the duration of action, the onset is about 5 to 15 minutes. Our peak for our medication is 30 minutes to about 2 hours. Our duration is about 3 to 6 hours, how long this medication is going to stay in their system as far as the action potential of it actually doing something for your patient. And then the special items per Nancy Caroline. It's a category C for pregnancy, and it also may precipitate angina pectoris. So albuterol, great medication, helps our asthma and COPD patients a lot. Make sure you listen to lung sounds if you can. Make sure you get them on end-tidal waveform if you can. Confirm that bronchoconstriction or bronchospasm rather. And that's it. See you next time.